Redwood Urgent Care is a brand new urgent care in town. It's a private practice of Dr. Waha Doula, who's a physician that's worked in this town before, about 10 years ago. Had to leave town, but never forgot the need in the town. So he is starting a string of urgent cares both here and in Humboldt County. His first one was in Eureka, we're his second one.
Okay, good.
So we're in the RHS building, which is, to my mind, on 101 North, but it's also called M Street. We're in the front part of the building that abuts the freeway. Okay.
One thing that I've always liked about this community is that buildings retain their old use as far as their naming goes.
Right, right, exactly.
The old RHS building probably says a lot.
The old timers come in and tell us actually that there's been a lot of different businesses in here.
Mm-hmm.
That's, I guess initially was a mule barn was the earliest use to house the mules that were used in the lumber mill that was right behind us.
Yes.
And then also was used for a long time as a hardware store. And you can kind of see it in the construction of the building that it's been through a lot of different renovations. So ours is the newest.
Mm-hmm.
And I'm a physician's assistant. My name is Lynn Zabo. I work under the supervision of Dr. Waha Doula, and I see patients here for acute needs. We're like the pinch hitters for the primary care people.
Okay, so and how's that different for the folks that, when you say acute needs, so just urgent care, basically?
Yeah, so you chop firewood and next day you have poison oak, or you get the flu, or, you step on a nail. We can evaluate, in the medical jargon, that's less than 6 weeks, a problem that less than 6 weeks. So more chronic care, say, high blood pressure or diabetes, that's managed on the primary care level, and that really requires an ongoing relationship. Acute care is something where somebody can come in and fix a really pertinent problem pretty quickly, pretty easily, and then get you back to the people who know you best medically.
So how does it work with insurances and paying somebody coming through? I mean, what do you take all the major insurance and Medi-Cal and partnership and all of that?
We take everything except for partnership.
Okay.
And the reason, and partnership is also goes by the other name Medi-Cal or Medicaid, which is different than Medicare. We do take Medicare, which is, say, what a retired person might have. The reason we don't take Medicare or Medi-Cal is because we've been in negotiations with them and they just don't seem to want to have us be a resource for those pays, which is kind of a bummer because we would do it if we could get a reasonable understanding with them.
Yeah, sure. So, and hopefully things will change and that'll open up.
We keep bugging them.
You keep bugging them.
So anyway, this is the lobby. You come directly in. Some people say it doesn't really look like a clinic. We wanted to have it on this side of town, kind of away from, the other doctor's offices, because we're interested also in reaching out to the tourists and things like that. The waiting area was specially designed by Dr. Waha Doula. He picked out the furniture and the rug and stuff. He likes interior design. No, it's pretty different for Crescent City. And he put a lot of expense into remodeling it, and you can kind of see that. We're also working on getting artwork hung here, maybe working with one of the galleries. We're kind of talking about having a rotating gallery space here. But as you come into the main part of the clinic, so what our setup is based on a practice franchise called Practice Velocity and Velocidoc. And so it's set up with kind of a central work area and then the exam rooms coming off. We have 4 exam rooms, a lab area, a splinting, casting, injection kind of area. Of course, the restrooms are that way. But what makes us really different is that we have an in-house x-ray. Oh, wow. This is a digitalized x-ray. I suppose we can walk toward it. Okay. It's brand new. We can send the images to radiologists. Our practice is in the southwestern part of the United States, kind of through Arizona, New Mexico, and California. They get the images and then they're able to read the x-ray and then give us a report back in about half an hour.
Oh, wow.
So that's different. A true urgent care has an on-site x-ray. It's how it's defined. It's kind of an evolving branch of medicine, but that's a clear part of the package.
And just taking full advantage of the ability to sort of network with folks from afar and
Right.
get their expertise.
Yeah, I can talk to the radiologist, and if they have concerns or questions about the exam or something, then I can report back.
Oh.
And it really helps their interpretation. The group that we work with is pretty much like 10 to 12 radiologists. I know their reading styles. I've been working with them for about 4 years. Yeah, so this is a resource that's not really found in, say, a walk-in clinic or anywhere else actually in Del Norte County.
Wow, that's exciting.
Yeah,
that's
it's
cool.
very cool. This is all lead lined, in case you're wondering if we're irradiating McDonald's. So we're also, we have splinting, and we don't really cast. Nobody casts anymore, really, but splinting and suturing materials back here. We have injectable medications to use as appropriate. We're going to have oral medications to dispense, like after the pharmacies are closed. Sometimes that's a problem if a kid comes in at the last minute and there's no place to get a prescription. We're going to have that kind of medication on hand. We have nebulizer treatments for people that have problems with asthma. We have dermabond, sutures, all kinds of wound care stuff for chronic infections. But we're also going to set up, in our lab area over here, we can do what's called CLIA-waived testing. So we have urine testing, pregnancy testing, rapid strips. But we're just tomorrow going to start setting up our DNA testing for strep, influenza A and B, maybe eventually gonorrhea and chlamydia, but not now, and hopefully RSV, which is respiratory syncytial virus.
So this is
a problem here.
I'm sorry, and what is the problem here?
Respiratory syncytial virus is a problem in the little kids, and it just seems to be common up here.
Wow.
So,
Is it what we would have called the Del Norte cruds for all these years? Just kind of that chunky sort of
No, it's
respiratory
different in
distress?
little kids. It's kind of a virus that causes a lot of nasal secretions and a lot of cough, wheezy, and little kids can't manage it, so their airway's compromised.
Now, how does the DNA testing? I mean,
What's
are you
cool
using?
about that is that in a regular rapid strep, like we're doing now, there's a 20% false negative rate. So it where we would miss a diagnosis of strep because our testing would say that it was negative. With the DNA, it's 100%. There's like no gray zone.
Yeah.
And it only takes 20 minutes of a nasal swab, so it's really going to be, I don't think there's anything like it in the community now.
That's the turnaround is 20 minutes?
Yeah.
Wow. Oh my
Yeah,
gosh.
20 minutes.
This, just as an aside, I worked in a genetics lab back in the 90s with PCR machines and all of these things, and just to have a 20-minute genetic turnaround, any
I know,
information.
isn't that cool?
That's amazing to me. Yeah,
it is.
Wow.
Yeah. And then you'll notice here too in our area, Dr. Waha Doula's design influence. You could see the sinks. He picked, an interior designer picked out these colors, the floor, all that. And so they wanted to make it a visually appealing place and kind of a restful, cheerful place.
I like the fact that the cabinet over here in this area over here is so retro. It looks like it's from an old hospital.
It's cool.
So how did you come to be here? Now you referred to yourself as what? As the
mother of the clinic.
The mother of the
I'm
clinic.
Mother of the clinic, yeah. So I worked for Sutter at the walk-in clinic for 20 years. I lived in Humboldt County, but I did kind of moonlighting and eventually full-time work. I started there when I had an infant. So she's 22 now. So I love this community. I think there's no better place for a healthcare provider to make a difference. And so Dr. Waha Doula's vision also kind of similar. He wanted to bring a resource to the community. And as a healthcare provider to work for another, like a physician, we don't have a lot of administrators telling us no. We're just here to do our best, be our best selves as providers and do our best job.
That's interesting.
Yeah.
So in a way,
it's very freeing.
And kind of old-fashioned too, right? I mean, really, if you back to country doctor sort of days, where just a free agent out trying to do the best you can without all the administrative oversight. Wow.
Yeah. Yeah, it reminds me of a couple old family practice doctors that we used to have here. Yeah, who actually made home visits and stuff. We don't make home visits, but we want to make this a comfortable, inviting place where people can come and get things explained, get testing that they need, get access to all the gee-whiz stuff that they would have in the city. So, yeah.
So, if aside from urgent care, is there information here? Are there things that you do as far as community outreach? If somebody has a question, a healthcare question, community-based healthcare, not an urgent care question, can they just walk in?
Sure. People drop by all the time and ask us, "How does the system work?" or "What's the best way for me to do this?" Because you met one of the medical assistants who's our resource person, and she's really good at interfacing with Sutter, but also with Open Door, and to try and get people kind of on the right track to get the information that they need. We also are getting ready, that's what this stuff here is, we're a corporate sponsor for the JC's basketball tournament, which you probably know is coming up in a couple of days. And so we're going to be tabling there and handing out water and mandarin oranges, but also pamphlets. And, I would think there's a lot of people that come from out of town and they might not know where to get health care then, and so the hope is that we're going to make it easy for them to come here.
Now, how long have your doors been open now?
Since October 10th.
Since October 10th, okay. How's it going? Are you getting a response from the community?
I think we are. And I think our goal is to be open every single day. Right now we're closed on Sundays, but that will change when we start getting more people. So right now it's really cool because there's no wait. Most people are in and out of here in under an hour. Even at our mothership in Eureka, his goal is to have people in and out in under an hour. So we have a really good EMR that was designed by a physician, a ER physician.
What's an EMR?
Electronic medical records.
Okay.
So it's very easy for us to prescribe, and it's very easy for us to print up informational stuff to give a patient a copy of their X-ray in digital form, or a copy of their records, so that they can take it on to their primary if they feel like that would be what they wanted to do next.
Wow, that's interesting. It does seem to be kind of a mix of brand new, high-tech, crazy 21st century stuff and an old physician, like small-town sort of approach. That's interesting. That's a nice thing.
Here's one of the coolest things, though. I didn't mention it when you talked about payment. We have a private pay option of $99. This is something that he's done for 4 years in the Eureka. And people who maybe have insurance that isn't accepted here, like Kaiser, and Kaiser doesn't cover out of the Kaiser area, they can go ahead and do the $99 option. So they get seen for $99, and then there's kind of a cafeteria style if they need. The $99 includes like a rapid strep test or a pregnancy test, but if they need an X-ray, that's $75.
So you're able to sort of piecemeal what you can afford, basically.
And his idea is not to have any private pay visit be more than $250.
Wow.
And these are not like sale prices that we're just doing to get people initially in the door. This is his commitment to the community.
Now, you spoke a little bit on the phone yesterday when we spoke about what the doctor's motivations are. Can you speak to that, about how he's come to do this, why he?
Yeah, he's kind of an amazing guy. He comes, he's trained. His name is Dr. Waha Doula. Waha Doula. He's a naturalized American citizen from Afghanistan. He was trained in Pakistan. His father and most of his siblings are physicians, some trained in the United States, some trained abroad. And his father's dream was to set up clinics in Afghanistan and probably northern Pakistan too, where mostly targeted at underprivileged populations or disenfranchised populations, specifically women and children. And they would be staffed with healthcare providers who weren't really necessarily trained at the physician level, but were ancillary healthcare providers like midwives, like somebody who had a special talent in healing, somebody who could work with broken bones. And
sort of the first person that if you had a need, you would talk to them.
Right, who were known to the community and part of the community and there. And so he set up a kind of series of clinics, but it became politically dangerous for them to stay in the country, and so
because of the clinics or for other reasons?
I'm not entirely certain. He doesn't really talk in detail, but his father was kidnapped.
Oh my gosh.
Yeah, and then as soon as his father, thank God, was safely released, and then the family had to leave the area. But I think in his mind, he's doing a similar thing here. Because
you said he focusing specifically on rural areas that might have...
especially in northwestern California. He did practice here, and although he didn't stay here, his heart is here. He appreciates the beauty of the area. He liked working with the people who were up here. He knows what their needs are, and this is an attempt to kind of reach out to them and see what we can give back.
That's amazing. Oh,
Yeah.
okay, so hours. When are you open again?
9 o'clock to 6:30. And we're open Monday through Saturday, and our hope is eventually to be open on Sunday as the summer comes.
Phone number?
Let's see. What's the same banner? I don't usually call myself.
Is that it there, the
Yeah,
460?
that's there. So our address is 286 M Street, Suite B, and then 707-460-1919.
And last one that always, and then redwoodurgentcare.com. I was going to ask about
Right,
the website.
and there's a lot of benefit actually to going to the website because it's possible to make same-day appointments on the website, and it's a really nice feature called a zip pass. So say I know that I have to come in because poison oak is everywhere, but I have to pick my kid up at school and I don't want to be stuck in a waiting room for 2 hours. So you can make a zip pass, for a certain time, and it's kind of a nice way to get cuts in line. It doesn't matter so much now because we're not as busy most days, but some days we are.
So it's sort of akin to scheduling an appointment at the DMV?
Yeah, kind of.
Only it works?
Yeah. yeah, it does. It works. You get kind of a priority movement through the clinic. Yeah, it works nicely. They're quite popular in Eureka.
Are they really getting those? Yeah.
Yeah.
Wow. Wow, so is there anything else? Anything else that you'd like to make sure we see and get covered?
I think I would mention that our sister clinic in Eureka has an associated laboratory with it, and it's not really known to most people, but in California, an individual can order blood tests on themselves and lab work like urine tests and things, but they have to pay for it. Their insurance company won't pay for it. So he has a lab there that has incredibly cheap prices. For example, a common CBC, which is a complete blood count, is $6. Comparably at hospitals, that can be up to like $350. So if somebody is concerned about their cholesterol, and they go down there fasting at the time that the clinic is open, they can just order cholesterol testing on themselves. If it's normal, then yay. If it's not normal, then they know the next step is to go to their primary care and have that discussion.
Wow.
And so I think a lipid profile is like $22. It's really cheap.
Does that happen elsewhere? I mean, having a lab that's basically open to the public.
I don't know of any place in Del Norte, Trinity, or Humboldt County that does that, and it's definitely worth the drive down. If people are going down there to Costco, they might as well go down fasting and check their cholesterol.
Yeah.
Where commonly people are worried about their thyroid, because they have weight issues or something. A thyroid test, I think, is $12. A hemoglobin A1C is $22, and a hospital comparable test is like in the 800s.
Wow.
So I know.
I do really want to talk to the doctor at some point just to get more.
Yeah.
It's amazing, and it seems like it's a perfect
Yeah.
fit for this community as well.
It totally
That's
is.
wonderful.
Yeah.
Okay.
Yeah, and I left Sutter about 2 years ago, and I've spent 2 years trying to get back here, and fortunately, somebody introduced me to Dr. Waha Doula. I worked with him for a period of time, and when he was comfortable with my experience and the level of my education and stuff, then he brought me up here for this, and I am living my best life.
Really?
My best PA life is like right here.
That's
my
great.
colleagues are amazing. We have a kind of a group kind of practice that we go by, assuming positive intent. So we try and keep it really uplifted and positive. We try and be kind to people because it's such a low bar and hardly ever met in this community.
You're absolutely right. So is that sort of culture? That comes from
him.
That comes from him too, just like the interior design.
Yeah, absolutely. He also happens to keep a stocked kitchen for us, stocked with food.
Oh, wow.
And my job as mother of the clinic is to go grocery shopping.
You got to go grocery shopping.
So he's an amazing guy to work for, and not only get medical care from, but to work for.
So we've met. Was it Diane?
2 Dianas.
2 Dianas. Other staff?
Yeah, we actually have we have a medical assistant named Leslie who is a heritage Spanish speaker, and I also speak medical Spanish, and we're reaching out to the Hispanic community because we know there's a large community around Smith River. I've known Leslie since she was a kid, I used to take care of her in other clinical situations. Our advertising's in Spanish, our paperwork's in Spanish.
Beautiful.
So they don't have to sign anything here that they can't read.